the learning objectives of the program. At the end of the program, you will be able to define the novel coronavirus disease 2019, appreciate the need to know about novel coronavirus disease 2019, discuss about the novel coronavirus, understand the modes of transmission of novel coronavirus disease, enumerate the clinical features and complications of novel coronavirus disease, and understand the diagnosis, management, and preventive measures of novel coronavirus disease. Introduction to novel coronavirus disease. The novel coronavirus disease is a global pandemic. Pandemic is a disease that occurs over a wide geographical area and affecting an exceptionally high proportion of the population. The current outbreak of novel coronavirus disease was first reported in Wuhan in China on 31st December 2019. On March 11th, 2020, the novel coronavirus disease outbreak was characterized as a pandemic by the World Health Organization. Why do we need to know about novel coronavirus disease? The novel coronavirus spreads from person to person silently, very easily, and can result in serious complications in a short span of time. It is most important to be educated with the current information about novel coronavirus disease in order to protect yourself and significant others from contracting the disease. About the virus. The coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome and Severe Acute Respiratory Syndrome. The novel coronavirus 19 is a new strain that has not previously identified in humans. Coronaviruses are zoonotic. That means they are transmitted between animals and people. Detailed investigations found that in the past, SARS coronavirus was transmitted from civet cats to humans, and the Middle East Respiratory Syndrome coronavirus is transmitted from dromedary camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. The virus that causes novel coronavirus disease infects people and spreads easily from person to person. The transmission of novel coronavirus disease. The virus that causes novel coronavirus disease probably emerged from an animal source, but is now spreading from person to person. The virus spreads mainly between people who are in close contact with one another, within about 6 feet, through respiratory droplets produced when an infected person coughs or sneezes. It also spreads by touching a surface or object that has a virus on it, and then touching their own mouth, nose, or possibly their eyes. In this slide, you find a pictorial representation of transmission of novel coronavirus disease infection. In this picture, you see how an infected person is actually transmitting an infection to a susceptible person either through close contact or through airborne droplet infection or through a fomite infection on the surfaces. The signs and symptoms of novel coronavirus disease. The novel coronavirus disease affects multiple systems. The common symptoms that you see are the respiratory symptoms, the systemic symptoms, and the digestive symptoms. The respiratory symptoms are coughing and sneezing, a runny nose, shortness of breath, breathing difficulties, and a sore throat. In severe cases, you may also see signs of pneumonia, severe acute respiratory syndrome, and lungs inflammation and congestion. The systemic symptoms that you commonly see in coronavirus disease are fever and fatigue. You may also see in some cases the digestive symptoms of diarrhea. The other symptoms that novel coronavirus disease presents are the excretory system symptoms, predominantly decreased kidney functions, and in severe cases it may cause kidney failure. The circulatory symptoms are the decreased white blood cells, and in severe cases it may cause cardiovascular damage. The diagnosis of novel coronavirus disease. The diagnosis is made based on clinical features and also a history of international travel or a close contact with novel coronavirus disease positive patients. The Centers for Disease Control and Prevention recommends collection of 3 specimen types, one from a lower respiratory tract, second one from an upper respiratory tract, and also serum specimens for testing. A real-time reverse transcription polymerase chain reaction, which is shortly referred to as RT-PCR test, is used to diagnose novel coronavirus disease infection. This slide shows the management of novel coronavirus disease. There is no specific antiviral treatment for novel coronavirus disease. People with novel coronavirus disease will get medical care to help relieve their symptoms. The novel coronavirus disease may present with mild, moderate, or severe illnesses. The mild and moderate patients generally have flu-like symptoms and which may self-regress over a period of a week or 2. The severe illness patients present with symptoms of pneumonia, acute respiratory distress syndrome, sepsis, and even it may lead to a septic shock. An early recognition of suspected patients allows for timely initiation of infection prevention and control. If there is only mild illness, providing care at home may be considered with strict precautions regarding when to seek the care. But to contain the disease, it is preferred to isolate the patient at an healthcare facility and discharge after the patient has been tested negative in 2 consecutive tests 24 hours apart. An early identification of those with severe manifestations allows for immediate optimized supportive care treatments and a safe rapid admission to an intensive care unit according to national protocols. All patients with severe acute respiratory infection related to novel coronavirus disease should be isolated at the first point of contact with the healthcare system. An emergency treatment should be started based on the disease severity. This slide shows monitoring of patients and contacts with novel coronavirus disease 19 infection. When a case is identified in the community, the first step is to identify the contacts of that case. All the contacts have to be monitored for 14 days from the time of exposure to the case. If such contacts show no symptoms, then the monitoring can stop. The case and the contacts which show symptoms have to be isolated, tested, and treated for COVID-19 infection. Such cases will be discharged after the relief of symptoms, and the monitoring of such patients can stop after 2 consecutive negative tests. This slide shows the measures to prevent the spread of novel coronavirus disease. The first step is washing hands frequently. Regularly and thoroughly cleaning hands with an alcohol-based hand rub or washing them with soap and water will kill the viruses that may be present on hands. The hand washing protocol are depicted in the picture on the slide. The second measure to prevent the spread of novel COVID infection is maintaining social distancing. Maintain at
अधिक
least
वीडियो देखने
1
के लिए
meter
चैनल को
or 3
सब्सक्राइब
feet
करें,
of
लाइक करें, शेयर
distance
करें.
between self and anyone, and particularly the one who is coughing or sneezing. This will help the droplet-based infection prevention. Measure to prevent the spread of novel coronavirus disease is to avoid touching eyes, nose, and mouth. Hands touch many surfaces and can pick up viruses. Once contaminated, hands can transfer the virus to the eyes, nose, or mouth. From there, the virus can enter inside the body and cause infection. Measure to prevent the spread of novel coronavirus disease is to practice respiratory hygiene. This reduces the chances of spreading the disease. This includes covering mouth and nose with a bent elbow or tissue when coughing or sneezing. And disposing of the used tissue immediately in a closed container is also very important. This slide shows the difference between an isolation and a quarantine. So isolation is done if you are sick. Isolation is meant to separate the sick people with a contagious disease from people who are not sick. So you must stay away from others for at least 7 days after your symptoms started and until all your symptoms have gone away. Isolation period is generally for 7 days. The quarantine is something that is done when you are exposed to a patient with novel coronavirus disease. A quarantine separates people and restricts their movement if they were exposed to a contagious disease to see if they become sick. For people who are not sick but may have been exposed in close contact with someone who is sick, you must stay away from others for 14 days to see if you will get sick. So the quarantine period is generally done for 14 days. This slide shows some guidelines for the people with travel history.
अधिक वीडियो देखने के लिए लाल बटन दबा के चैनल को सब्सक्राइब करें, लाइक करें और शेयर करें.
The persons who have recently traveled from an area with ongoing spread of novel coronavirus disease should inform the same to the healthcare authorities and follow restrictions of movements or quarantine for up to 2 weeks. If a person develops symptoms during that period, such as fever, cough, and difficulty in breathing, medical care is immediately sought. This slide shows the people who are at high risk of novel coronavirus disease. The population who are at high risk are the elderly population who are more than 60 years old, people with decreased immune conditions such as cancer, people with comorbidities such as diabetes, hypertension, and kidney disease, and infants. This slide shows common mythbusters published by the Government of India. A cold weather and snow cannot kill the coronavirus. The coronavirus can be transmitted in areas with hot and humid climates. The coronavirus cannot be transmitted through mosquito bites. There is no evidence that companion animals or pets such as dogs or cats can transmit the coronavirus. Taking a hot bath does not prevent you from getting coronavirus infection. Hand dryers are not effective in killing the coronavirus. Ultraviolet light should not be used for sterilization and can cause skin irritation. The thermal scanners can detect if people have a fever but cannot detect whether or not someone has the coronavirus disease. Spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B HIV vaccine, do not provide protection against the coronavirus. There is no evidence that regularly rinsing the nose with saline has protected people from infection with the coronavirus. Garlic is healthy, but there is no evidence from the current outbreak that the eating garlic has protected people from the coronavirus infection. Antibiotics do not work against viruses. Antibiotics only work against bacteria. To date, there is no specific medicine recommended to prevent or treat the coronavirus infection. The conclusion: the novel coronavirus disease 2019 is an infectious disease caused by a newly discovered coronavirus. The best way to prevent and slow down nCoV-19 transmission is by being well informed about the novel coronavirus disease virus, the disease it causes, and how it spreads. Take care of your health and protect others by following the measures and guidelines shared in this course, which are sourced from World Health Organization, the Center for Disease Control, and the Ministry of Health and Family Welfare, Government of India.
Thank you for watching.
I thank you for joining Apollo MedSpeak's program